Okay, welcome back to the podcast known as Knife After Death. I'm Dr. Wolfe. I am a forensic pathologist, which means I am a medical examiner. And I want to talk about drowning today. Very important topic. Basically, what I have understood by being on social media is that people don't understand how a lot of these concepts work in forensic pathology. Drowning is right at the top of the list. Probably one of the most misunderstood causes of death that exists, right? Because when you think about like gunshot wounds, stab wounds, blunt force trauma due to an accident or something, it's pretty obvious the cause of death. It's oftentimes the manner that the pathologist is trying to determine. But when it comes to something like drowning, and I am directly quoting a textbook on this topic, there are no pathognomonic findings of drowning. So what does that word mean, pathognomonic? It basically means there are no specific findings that guarantee an investigator that this is a drowning. Versus something like, let's just say, an aortic rupture. With an aortic rupture, a pathognomonic finding is going to be a breach in the intimal surface of the blood vessel, blood collecting in the tissues surrounding the aorta, and even in the pleural or abdominal cavities. So that would be like a pathognomonic finding. We usually don't use that term except for in surgical pathology. So in surgical pathology, there are thousands and thousands of diagnoses that we have to make, many of which have a pathognomonic finding, which allows us to make the diagnosis definitively. Drowning is not one of those. And so, instead of doing like a specific breakdown of a particular case, and I know there's been one in the news recently where a lot of true crime amateur kind of like commentators on the issue have given their opinion on the case, and that therefore the medical examiner must be wrong because they have determined that it's a drowning, despite never investigating a drowning case and having no training in doing so. And here's the crux. And so I've been thinking about this for a long time, like how can I most succinctly explain drowning in a way that everyone understands? And unfortunately, it's difficult to be succinct because you have to understand a lot about the body in terms of anatomy and physiology to understand drowning. But I'm going to give it a shot. Number one, the lungs are not bags, okay? So every time someone gets diagnosed with drowning, and it doesn't matter if it's, Riley Strain, or it is Aaron Carter, or it is Matthew Perry, it does not matter. There's always a line in these autopsy reports that says no water was found in the lungs. And then, these people will take that line, they'll go on, they'll make their TikToks, they'll make their YouTube, and they'll say, clearly it wasn't drowning because there was no water in the lung. Okay, let me explain why that is. The lungs are not bags. The lungs are sponges. Okay, if you've ever followed me on any social media, you have seen me post pictures of lungs that are cut open, and they are not empty bags. They are very dense sponges. And as a result, if you were to take the lung, turn it upside down, you're not going to have water pouring out of the bronchus. The water enters those little tiny airways, those microscopic alveoli, and can make the lung heavy. That's called pulmonary edema, intraalveolar fluid, and that's why you don't have, quote, water in the lungs. First of all, let me say that if you ever train with me, I will tell you to never put that in a drowning autopsy report because it is an absolutely meaningless phrase. I have seen countless drownings. The first case I ever did as a forensic pathology resident was a drowning, and I have done countless, dozens upon dozens of cases since then over the last 10 years. And the number of times I have been able to take a lung and try to empty water out of it, I would say less than 5% of the time. And the only way that you can tell that water from a body of water, like a pond or a creek or something, was in there is because you see other things that are in the bronchus that show you that it was a type of groundwater or fresh water, such as a little bit of like mud or little, I guess, sedimentary things in the water that come out of the bronchus, sand, even small creatures that you can see, little tiny little fish or something like that. Sometimes you'll see that. But that's the only way. So if you've got somebody that drowns in a relatively clear kind of water, like a pool, for instance, it's not common to take the lung and be able to pour water out of it. Because again, it's a sponge. Water is entering into that sponge and the body literally soaks it up. And here's another key. This is another key. If the heart is beating after the water enters the lungs and the breathing is ceasing, the heart beating for even a few seconds or a minute or something like that can actually extract some of that water out of the alveoli into the vascular system. So, in other words, you can have a drowning where there's a lot of water swallowed, but then you get the lungs and there's really not much there because the heart was beating after the breathing stopped, okay? But so that's the first thing. You have to understand lungs are not bags. You will almost never be able to pour water out of a lung. It's just not something that happens. What you do is you measure the weight of the lungs, which are typically in an adult maybe 300 to 400 grams, something like that. But in a drowning lung, if there's a lot of water soaked up into that sponge, they'll be heavy. They might be 700 grams or 800 grams or 1,000 grams combined. Also, when you cut the lung, instead of it being soft and not very wet, the foam will actually pour out of the cut surface, okay? Now, the caveat to that is that's not always the case, and I will get to that point in just a moment of why the lungs don't have any water in them at all. The second part you have to know about this is that it doesn't take very much water to actually drown a person, okay? Let me give you an indication. And this is straight from the textbooks. The amount of water that it takes to create a drowning is quoted in the source Dolinak, which is a great forensic pathology book. That's the one I always refer to when I need to look up something. Is 1 to 3 milliliters of water per kilogram of body weight. So let's say somebody weighs 70 kilograms, which is about 150 pounds. You can drown with as little as 70 milliliters of water being swallowed down into your lungs. On the high end, it's going to be 200 milliliters. Okay, so to put that into perspective, and I'm not going to do the conversion to how many tablespoons or cups that is because I can't do it in my head because I need to look it up. But what you need to understand is that most of you listening to this have probably had at least one science class, and in that science class you can think about beakers where you've mixed chemicals in. The most common beaker used in, let's say, a high school chemistry or biology class is probably a 500 milliliter beaker. So the maximum amount of water in these cases is usually about 3 milligrams per kilogram or milliliters per kilogram or 200 mils. So less than half of a 500 milliliter beaker can produce drowning. That's not very much. Now, let's circle back to what I said. It's a sponge. It would be very easy for lungs, two big lungs, one on the right side, one on the left side, to soak up 200 milliliters of additional fluid. And in addition, you have to understand the lung is kind of, there's fluid in it already. Inside of the airways, we have a fluid called surfactant, and that allows for the alveoli to expand and contract appropriately, and it helps in diffusion of oxygen and CO2 across the membranes. So you've got surfactant. You've also got lymph, as you know, from lymph being drained to the lymph nodes. And you've also got blood. So the lungs themselves already have a lot of fluid in them, but not in the airways. The key is, where is the fluid? And so if you inhale 200 milliliters of water in a drowning situation, that could be enough to fill those alveoli enough to decrease the oxygen exchange, which is what produces death, okay? So, I'm just trying to get at the fact that it doesn't take much water. Okay, that's point number 2. Point number 1, the lungs are not bags. And point number 3 is that you actually don't need water inside of the lungs for it to be a drowning. Now, that sounds confusing, right? But that's because there's a lot to the science of death that is not a public knowledge, that people don't understand. We do autopsies on people who have drowned, and sometimes we find lungs that are big and fluffy and airy, and that's the only way to describe them. They're so filled with air that the lungs will actually cover up the heart and touch in the midline. So when we take the sternum and the ribs off, we see the lungs touching, and they're fluffy. And you take the lung out, and if you were to squeeze it, you're not even going to get any fluid out of it. It's going to be like almost like a balloon type effect. So why is that? Well, I'm going to tell you what the theory is. The theory is that the prospect or the event of drowning resulting in a laryngospasm, which causes the larynx, the vocal folds, to actually close off, which restricts air movement into the body. The epiglottis might actually fold over, just like when we swallow, and the epiglottis covers up the larynx. You have a laryngospasm, which then produces, it is like a suffocation. So the person is in water, they are struggling, they are drowning, but they are not swallowing water. Okay? I was reading TikTok comments the other day on this case of this kid, I think it was in Nashville, who was found. And I saw creators who were scientists but not physicians, who were commenting definitively that this person had died prior to going into the water because there was no water in the lungs, and obviously that's the case. And that's the thing. What people don't understand, there's a lot to forensics that doesn't really fall under the realm of regular medicine, okay? And certainly not other scientific creators who, by the way, often chastise people for speaking out of their fields. So, for instance, if I were to speak on cardiology, I'm speaking a little bit out of my realm because I'm not a cardiologist. Just as if I was going to speak about being an electrician. I don't know anything about that, and I shouldn't speak about it. And so I must say I was a little irritated to see people speaking so definitively on this matter, because I've laid it out for you already. I could stop the podcast now and you understand that there are people, many people, who drown and do not have water, quote, in the lungs. But we're going to talk about it just a bit more, okay? What are the other findings of drowning? Well, of course, you could have heavy lungs. You can have light and airy lungs. We've already established that. But you also can have water in the stomach if there's a lot of swallowing of water occurring during the drowning incident. Particularly if you find, again, sedimentary things or aquatic life in the stomach. And yet, this is not a pathognomonic finding either, because after death, the gastroesophageal junction, the sphincter of the esophagus to the stomach, relaxes because muscle relaxes after death. After, first of all, immediately after death, and then rigor mortis sets in, and then it relaxes again. So water could passively enter the mouth and go down into the stomach. A decent one that I have found, and this is what being in forensics is a little bit different than regular medicine, is water that you can get from the sinuses. So the sphenoid sinus, the ethmoid sinus. And the way to do this is not quite easy. You don't just go up the nose and put a syringe in there because you're just blindly drawing fluid. You actually have to go in through the base of the skull, and you have to know the anatomy, where the sinuses are. So what you do is you try to cut a little aperture in the base of the skull above the sinus and enter, and then you put a needle inside of that, and you try to draw up the fluid. And if you can even test that fluid. They've done that before. So when I see water in the ethmoid sinus or the sphenoid sinus, I feel a little bit better that it's a drowning, but it's also not something we do on every case. It's also something that's not easy to do, and it's not something that certainly the public understands. If this case in Nashville, the doctor said there's water in the ethmoid sinus, I can assure you 99% of the people reading that would probably pass over it and not think anything about it. But the reason why that's not a great test either is sometimes if a person has sinusitis, they can have a little bit of extra fluid in their sinuses. You can see that on CT scans. You'll see a CT scan, it'll say air fluid level in the sinuses. And secondly, you can get some passive water into sinuses. So stomach and sinuses are something there that you look for. But basically, the other thing that comes up here is a lot of people ask me, well, what about dry drowning? Okay. And that's another problem, because there's a misunderstanding about what dry drowning means. So there are people who have a drowning incident, but they're revived. And what I say by drowning incident, maybe they're submerged in a pool, they pop up, they get a little bit of CPR, they actually regain their heartbeat, they might even be awake, and then they die a few hours later or a day later. A lot of people refer to that as dry drowning, and it may well be a term that's in use in clinical or emergency medicine for that particular thing. And the mechanism there is thought to be that there's electrolyte imbalances as a result of swallowing the water, getting the water into the lungs and having it resorbed into the circulation can cause problems with things like potassium, which can cause cardiac arrhythmia. You can also get brain swelling from having that extra hypotonic fluid in the vascular system. But dry drowning in the forensic sense is what I have just described to you with the laryngospasm. Okay, and the idea is that when we do the autopsy, we're not finding the aquatic life, we're not finding the sediment, we're not finding the mud, we're finding the big, air-filled lungs. And the problem with that, in terms of autopsy, is that you cannot demonstrate a laryngospasm at autopsy. That is a physiologic occurrence that is occurring at the time of drowning. Larynx slams shut, your body's trying to breathe, the air in the lungs expanding the lungs to be big and fluffy and airy, which, by the way, has a term, and it's called emphysema aquosum. Okay, that's a term that you will probably never hear in your life. But in forensic textbooks, emphysema aquosum refers to the inflated lungs at the time of drowning. And so the theory is that there may be a physical plug, such as like mucus or the obstruction due to the laryngospasm, which causes these lungs to be kind of like light and airy and puffy. The problem is that this is theory or hypothesis. We don't actually know the mechanism. But what we do know is the observation, where you have a person, let's say, witnessed clearly drowning, you do the autopsy, and you find the big fluffy lungs and not the heavy lungs. And sometimes we do autopsies that are witnessed drownings, okay? And then you'll say, well, why do you do it if it's witnessed? Well, sometimes you do it because you want to find out if a person has had if they're having another type of medical condition like a heart attack, which produced the drowning episode. So that's the main reason why we do it. Also because these are accidents, and accidents usually require autopsy, particularly if we're talking about life insurance type stuff, because there can be higher payouts for accidental deaths. Third is that oftentimes drownings occur in public spaces, so like public pool or a state park, that type of thing. And as a result, there could be litigation involved. And if there's no autopsy, litigation is essentially, it's much more difficult, let's put it that way. So there are lots of reasons to do autopsies, even when they're witnessed. But the weirdest ones for me are ones that aren't necessarily witnessed, but ones where you see somebody on like a security camera who have drowned in like a, let's say, an apartment pool or something like that. And I have seen these cases before, and we review those tapes because it's part of the evidence. It's part of the determination of the manner of death. And so it's a little strange to see somebody struggling, and we've actually had to watch people drown on tape. And I'm telling you, it's a really weird thing. And that's one of the parts of forensic pathology that, you have to understand that it can be kind of brutal in that if something is caught on tape, very often we have to review those tapes. So I have seen people drown in pools. I have seen people get hit by cars. I have seen people shoot themselves. I have seen people shoot other people. And that's something that in this field, if you can't feel like, and I'm a little bit on a tangent here, but if you feel like you can't do that without severe kind of like psychological damage or stress, then this field is probably not for you, because you have to be able to see that stuff and look at it scientifically and then sort of delete it from your mind. And I have seen cases, for instance, of drowning where we've done the autopsy and the person clearly was drowning and struggling in the pool. And then you do the autopsy and you find this emphysema aquosum, where it is big fluffy lungs, no water in the lungs or stomach, and you have probably a laryngospasm or something similar that closes off the airway. So I think that, this is a really quick podcast to let you understand that drowning is something that is not, I would say it's not easily determined. It's determined based on circumstances and not so much on anatomy and pathology. And that's, I think, where the breakdown between what we do and what the public knows or thinks they know is a problem, because the public, I'll be honest with you, if I didn't do this job, I probably wouldn't realize that either. I wouldn't realize that, oh, well, you mean you there isn't water in the lungs? No, you have to physically look at and touch a lung to see that it is, in fact, a sponge. And so you pour water down the bronchus, and it's getting soaked up right into the alveoli. So what I don't understand, though, and this is me just being kind of like, a little bit cantankerous, is why pathologists continue to use this line in autopsy reports. It is almost a meaningless line. And that's just from my experience, it's almost a meaningless line. But I would say that the better way to phrase it would be something like, there is no evidence of aquatic life or sedimentation, dirt within the airways. But to say water or something like that doesn't make any sense, because the water is almost always going to be soaked up into the airways in a drowning incident. Again, one textbook says that almost all drownings are less than 4 milliliters per kilogram of fluid. So again, if we go back to our 70 kilogram person, that's at most 280 milliliters, which is still about half of a 500 milliliter beaker. Okay, so just keep these things in your mind. The lungs are not bags. The lungs are sponges. Laryngospasms can occur, and there are no pathognomonic findings of drowning. So that would be kind of like as much as I want to say on this topic today. But if you have any questions, you can message me. And what I'm going to try to do is I'm going to try to maybe put up a few more posts on this topic so that people can continue to dispel the misunderstandings of drownings, of the drowning process. But again, if you're a young pathologist or a pathology resident or somebody that wants to go into forensics, I would tell you that it's probably not worth saying there's no water in the lungs. What's more important is the lung weight. And then also, I think it's very important. I didn't used to do this, but I think it's kind of important these days to put a comment, like a diagnostic explanation. So if you have a patient with big inflated lungs and no water, I think it's very worthwhile to put a comment and say, well, this could be due to a laryngospasm, which has been theorized in forensic pathology, blah, 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 these textbooks and this research literature. I certainly am going to do that in the future because we live in a time where every single thing that occurs, every single death that occurs is all of a sudden a conspiracy and it's a cover-up and it's a murder. And I've had multiple requests this week to talk about this topic for that purpose. So I will, at that point, I think that I will go ahead and wrap up here, and I will remind you that I have a Substack which has free posts and paid posts. The paid posts are the ones where I'm kind of doing like more advanced pathology and anatomy images and quizzes, probably really good for medical students or healthcare nursing students, things like that. Anybody who's interested in pathology and medicine. So my Substack's kind of my main thing right now. I still have Instagram, The Dead Letter, TikTok, The Dead Letter. Not a ton of posting on there lately, but I'm mainly because I'm overwhelmed with comments and I can't respond to everybody. So yeah, if you like those things, you might want to consider, if you like that type of thing, you might consider subscribing. And I hope that I was clear today. And if not, I can do a follow-up. Just send me a message and say, I don't understand what you mean by this, or this was a terrible podcast or something like that. And I'll be happy to address that. So again, thank you for listening, and I'll see you next time.